Hey, this is Danielle from Black Business Boom in Black Owned Nashville, and I'm here with our industry expert, Cory Beal. We're going to be talking about insurance today, specifically for the small business owners during this open enrollment time. And we have Brandy Himel joining us as well. She's going to be helping us out and giving us some facts about healthcare. I know a lot of folks that are business owners, it's a huge concern, especially even as you're transitioning from or planning to make the transition from working for a company to working for yourself. One of the huge things that a lot of us have worried about is, what about my health insurance, and finding the best options that are going to be cost effective, for our lives, because that's a big transition as well. And then even as the healthcare.gov marketplace has been introduced, many of us have tried to navigate it, tried to pick the best plan, and it has not gone our way. So that's what Cory and Brandy are here to help us with today, to give us some tips on how to go about getting a plan as a small business owner and how to choose the best one. Cory, let me start with you. Give us a little insight into the healthcare marketplace and just like where we should start as a small business owner in exploring healthcare options.
Well, as a small business owner, I want to say this, Danielle, there's never been a perfect time to be a small business owner. We can talk about the negative impact the pandemic has had on us as a nation, but it's also been a wealth of opportunities that we can all prosper from and benefit from. Because, one of the main reasons people stay in a 9-to-5 and don't engage or explore being an entrepreneur is what? They benefits.
Yep.
Right. And so in today's climate, the reality is, whether you want to accept it or not, COVID kind of eliminated the excuse, because there's certain subsidies that's out here that is allowing you to walk away from your job with not the same or even better benefits. And there's a great chance that you might be paying zero, nada, so nothing for health insurance.
Amazing.
So the first place I implore all small business owners, as when I talk about life insurance as well, not only do you need to do a life insurance annual review, policy review, sit with your local broker and do a healthcare review, a health plan review, right? Because you may need to add more to your short term. You may need to add more disability. You may need to add more accidental. You may need to understand the purpose of having a high deductible for a low premium or a low deductible. Like, you dig what I'm saying? So, because you can afford the high premium, right? So start with your local insurance broker, your industry expert, Cory Beal.
Exactly.
If you Black people make a move, Nashville, so we can help you navigate, going through the healthcare, because like my business partner, Brandy, says, who is a monster in this. That's the reason why I got her on, because I want to make sure that she really breaks this down so it can't be broken down anymore. You don't want to go on those sites because it can become confusing, because understanding so healthcare insurance is not nothing we talk about unless it's an excuse to keep us at our 9-to-5.
Yes.
That's what it matters.
It definitely has been a hang up for a lot of folks, and even just like, I don't know, can I get insurance? Like it's not something that was necessarily possible or easy, 12, 13 years ago. You were just like, I need insurance. Like, I don't know where to turn. Now we have the marketplace, and it still is like, I know I can go out here and I can do the application, but like, how do I choose a plan? How do I get the best plan? How do I get these benefits that Cory is talking about that we have during this time? But we've also been seeing a mass exodus from corporate America, right? So that's why I thought this was really important for us to talk about, especially during the season where we can enroll. So Brandy, let's go ahead and turn it over to you, and let's just walk through how to find a policy, how to get started, and how to choose the best policy for us.
Sure. So, hi guys. Thank you for having me on today. I appreciate it. Like all of you, I'm a small business owner too. So I understand all of the things that you're battling and having to weigh your options on. And, health insurance doesn't have to be hard, but it's very important. So, for those of you who have been in business for a long time, I encourage you to throw out every single thing you ever knew about health insurance. That's the biggest thing right now that holds people up, is holding on to things that they used to know. There's been so many changes. I mean, even from last year, there have been so many changes that have happened. So a lot of times being hung up on things you know keeps you from moving forward with what really the better thing to do for yourself is. And if you're new to this, I'm just going to be honest. Health insurance is boring. Nobody likes to talk about health insurance besides people who sell health insurance. But keep in mind that your health insurance, whichever way you go, whether it's through the marketplace, employer-sponsored coverage, some of the alternative plans, those things are in place for you on your worst day. They're not in place for your best day when you're out having a great time, making sales, making money. They're there for when you need it. So it's really important to make sure that you do a full analysis and understand what you're getting and what you need to protect. And that's one of the things that I hear from entrepreneurs all the time, especially you realtors out there. Okay. You guys all want to have some sort of coverage, but don't always know what it is that you need or what's going to actually be the most financially beneficial to you. Something that's cheap is not necessarily something that's going to cover you. And so I tell people, make sure when you're making this decision that you fully understand what your limits to coverage are. Make sure you understand what's included. Make sure you go through the what ifs. What if I never use this? Okay, that's great. Good for you. Please do your preventive. If you get a marketplace plan, it's free. Take care of yourself. And the Black community, especially, it's an underserved market, and people don't always do the preventive maintenance that's so important. And that's why you see really high mortality rates. And it does not have to be that way. One of the things that my business does in particular is we serve underserved communities. We're out in Hispanic populations. We're in low economic populations, because honestly, that's a vulnerable population, and those people don't always have access to brokers. And if you go to healthcare.gov and try to do this yourself, first of all, healthcare.gov is not a .gov site. It is controlled by third parties. So anytime that you go to healthcare.gov, you're going to start getting all those robocalls. Great place to go to find a broker if you don't have one in your area. But there's not a state that Cory and I can't help you in. So the second thing I would highly encourage you is to make sure you work with an independent broker. If you're talking to somebody who only works for a carrier and who is a captive agent, they don't care about your best interest. They care about the best interest of the one company that they work for, and they're going to sell you a plan within that. Otherwise, they don't get their paychecks and they don't continue to keep their job. So if you choose to work with another broker, you need to really ask, are you independent? Do you represent all the plans that are available in my area? Because that's the only way you're going to get a fair assessment. Also, ask them, do you do the shareables? Do you do the short-term plans? Because if a marketplace plan is not for you, you need some alternatives, and you shouldn't have to go start over at the beginning looking for somebody. So a full-service independent broker, we get paid by the carriers directly. There's no cost for you. If you're working with a broker who's charging you a fee to sit down and have a consultation, move on to the next one, because that's not how that should be either.
That's the life insurance as well.
That's exactly. Anybody who's charging you a fee who works in this business is not working in your best interest, period. And then the third thing, you need to make sure that you're not just talking about the money. You need to be sure you're talking about, do you have a preference in hospital systems? Do you have a preference in providers? What is your current health situation? What is your family's health history? What type of activities are you involved in? Are you high risk? Are you going mountain climbing and dirt biking and mudding and all those things? Or are you kind of a desk jockey like me and sitting in, the same spot all day and worried about carpal tunnel and not broken bones? So those are things you need to know. You also need to know what the limits of coverage. What is your stop loss? And that's where I think entrepreneurs overlook a lot of different policies, because there's a lot of things that parade around, like health insurance, that are not true health insurance. So number one, bona fide health insurance has no pre-existing conditions. So it doesn't matter what you've had happen to you. There's no difference in your premium versus the person next door to you who, may have had cancer or may have had a car accident. Your insurance through the marketplace is based on your zip code, your family's modified adjusted gross income, the ages of the people in your family, some carriers' smoking status, and your choices of networks and things like that.
Right.
So important to know those. Important to also know that every plan has what's called a maximum out-of-pocket cost. And for entrepreneurs and self-employed, that to me is more important than anything else within the plan. It's more important to me than the premium, because you need to know, do I need to get a plan if something were to happen to me? If my max out of pocket was $8,700, can I afford that? Or is that going to bankrupt me? If that's going to bankrupt you, then you've got to have a whole different discussion. If you say, oh, $8,700 is good for me and I'm super healthy, then cool. Maybe you can go with a $0 premium plan and get the entry level. If you're somebody who is going to the doctor for, a chronic condition, sickle cell, diabetes, MS, things like that, then you need a higher level plan, because every time you go to the doctor, you're going to need to be paying for something.
Yep. So not just that, another thing that's important is because you want to make sure that's where family history come in as well.
That's right.
You got to look at your family history, because that is a great, predictor of your health.
Right. And your family history, unlike in life insurance, your family history will not affect your premium, but it can affect which type of a plan you need to be in and what things you need to plan for. And so, those are the main tips of things that you need to look for when you're in the marketplace. Couple of things to know about this year. There's some extra subsidy available due to the COVID Relief Act. And so for entrepreneurs especially, this is a great year, especially for you people that are high earners. If you're on the higher end of, there's this chart called the federal poverty level chart, and it's small. But Danielle, I could email this to you.
Please do. Yeah, that'd be great.
This chart is really good because it tells you household size and then percent of subsidy levels. And for people that were high earners, you used to cap out, that was what was considered the 400% of the FPL. But now, because of the COVID Relief Act, insurance just can't cost more than 8.09% of your family's modified adjusted gross income. So people who had previously not been subsidy eligible are this year seeing a lot of subsidy eligible. I mean, a family of just say 4, you can make up to about $112,000 a year adjusted gross and still qualify for subsidy. And that's pretty hefty. I see people tell me all the time, oh, we don't qualify for subsidy. And I just had somebody yesterday, their family of 4 makes $95,000 a year. They qualified for $1,100 a month in subsidy, which is what helps you pay the cost of your premium.
Repeat that one more time so they can understand that $0 is coming out their pocket because the subsidy is paying for your health insurance. So to get an $1,100 a month plan, you got to ask yourself, they probably going to the Vanderbilts, probably got the best doctors. Yeah. They're picking a plan that's really going to protect their family.
Because
especially during this time now.
Yeah.
So, and there's two components to the subsidy. And this is, I think, one of the things that people just don't understand. But to me, it's the second most important thing besides that maximum out-of-pocket cost. So a subsidy is what the government gives people who are working to pay for the monthly cost of their premium. There's another component for individuals within a certain income bracket that is called cost share reduction. And on the marketplace or Health Sherpa or somewhere that you can look at these, it's called CSR. And it looks like a little sunshine and it's yellow with like blue letters. It says CSR. That's cost share reduction. Those are only good on silver level plans. But the cost share reduction makes everything within the plan cheaper to use. It reduces your deductible, your maximum out-of-pocket cost, your cost to see the doctor, your copays, your co-insurance percentage, and your prescriptions. So sometimes people will choose a $0 bronze plan, but they could get a silver level plan with the cost share reduction for, say, $24 a month. So if you're somebody who never, ever goes to the doctor, you're young and you're healthy, great, go with the bronze plan. if that $8,700 max out of pocket doesn't scare you. But on the silver plan, you might pay $24 a month, but it only costs you $5 to go see a doctor and $4 to have your blood work done. And there may be prescriptions for $0 a month or $5 a month. So if you're somebody who's going to be using your benefits, it's worth it for you to pay that $24 a month versus the $0 a month, because every time you go to the doctor or do something within the plan, it's free or cheap. And then your out of pocket, your max out of pocket is reduced. So the example that I told you today, the family making in the $90,000, $97,000 range, it actually reduced their family's entire max out of pocket to $2,300 for the whole year. And what that means is once so say they, I don't know, child broke his arm, they meet their out of pocket.
That's pretty easy.
They're done for the entire year, for the whole rest of the year, every single thing they do within their plan. They could get cancer and they pay $0 because they've already met their family's max out of pocket cost. And so that's why I say that max out of pocket cost is more important than the premium. That's something to pay attention to. Can you afford to use the plan that you choose for?
I mean, I'll tell you one thing. This day and age, we really don't know what's going to happen. Even for someone who's fairly healthy, you really just don't know what's going to happen, whether, maybe the new variant of COVID or a car accident, we just don't know what's going to happen. So that's why this is so important.
You just said something so key, Danielle, because I was just about to tack on that. Y'all, COVID isn't going anywhere.
That's right.
Every year is going to be another variation of the COVID that should be more and more dangerous. This is why it is to your importance to ensure you have proper health care. And I'm also say this is what many people don't know as well. Insurance companies, they're catching up to what's what I'm looking for. They're catching up to people with COVID, right? They got to make their adjustments because now on applications, they're asking, have you been contracted with COVID? You have some companies that deny, that raise the price. That's why the subsidy is so important. You know what I'm saying? Because if they do realize that you have COVID and it's been in the past 12 months, you could possibly get denied.
And so that's going to apply to life insurance, and short-term policies.
Yeah, I was going to get to that. Right.
Yeah.
So you got it. So that's why it's important. That's why it's important to really look at your healthcare plans, because it's really like we could go over the plans that's on the market. It's 4 plans: bronze, silver, gold, platinum, right? But for the most part, you might need a good, like she said, with the CSR. Hey, what's $25 a month? If I could get the silver plan, that's a step above the bronze, right? Yeah. So that's why it's important.
I think
continue though, Brandy.
Is what I have, the key that I want to impress upon people today is how complicated it really is, right? And so how important it is to have a broker, because it's been great, a lot of great information in a short amount of time. But then even as we go and try to apply it to our own lives, we're going to be like, wait, what did she say? She said, it's so important to work with someone. Again, it doesn't cost you anything to work with a broker and for them to find the best plan for you. They get paid on the back end. They're going to get paid from the company, whichever company you go with. And I think it's very important what Brandy said about going with someone who has access to all of the plans. I worked in health insurance for years. So when I was working for WellCare salespeople are out selling WellCare. Your best plan may be over at Humana or Cigna or United Health, but it's their job to sell you on WellCare. It's like we see the commercials that come on and they're like, call WellCare, call Humana, but there are people out there that can look at all of these plans and determine which one is going to be beneficial for you. And that person for our community is Cory Beal. So make sure that you're tapping into Cory, who is our industry expert. I'll make sure his information is available and his Calendly link is dropped in the comments. So come back to the comments. It'll be there. Get in touch with Cory. Let him understand again what your family history is, what your goals are for your family, what your health situation may be over the next year, so that he can find the best plan for you. Because I'm telling you, I have been through that healthcare marketplace, and it is not a walk in the park. Like it is
Right,
not.
but you're also someone that have experience, so you kind of knew what you was
And
looking
I
for.
still don't know. So that's what I'm
Oh,
saying. Like, I've worked in insurance for years, and I'm still like, wait, what? I tell you, I miss for sure. Even folks that work in corporate America now, it's like I remember when it was just HMO or PPO. That's all you chose. Did you want the HMO or
Blue
PPO?
Cross, Golden Rule, or
Now it's like
Cigna.
all of these
That's it.
plans, and we're like, everybody is confused, even when they're choosing from their jobs. So even to have a resource like Cory in our community to run things by and to understand these policies a little bit better, even if you're working a job, use Cory as a resource. And as he said, also he's here to do life insurance policy reviews for you as well, and make
Hey,
sure that
Danielle,
you're
let me touch on something that Brandy didn't touch on that many people don't know. Brandy, touch on the importance of we can even offer you better insurance than your job can offer you.
Yeah. So I worked in corporate benefit design. I've designed employer benefits for companies like Walgreens, JCPenney's, and Bed Bath and Beyond. So I've been on that side of it. And one of the things that employers are struggling with right now is meeting the cost. Group plans are very high. Tennessee is a state. You guys are a little bit better off than I am here in South Carolina because you have several group carriers that are there. But your costs are still very high. And so a lot of the times employers have to pass that on, or they give you plans that are very expensive and just really hard to use. I can't tell you how many times corporately I'll go into a place and do a review on their plan, and we'll do a survey, and they'll find out that 70% of their people didn't even go to the doctor one single time in a year. And that's insane to me for the amount of money they're spending, but they're afraid because the people can't afford to use the plans they have. And so the government has in the last 2 years come in and said that the cost of your coverage can't cost you more than they've lowered it again because of the COVID Act, but again, more than 8.5% of your income. It used to be 10%, and this year they've lowered it down to 8.5%. So so it might be, if you're a single individual, then you have to just look at your personal income and the cost for you to be covered, and that's under what their mid-level plan is basically. But then if you have family, sometimes the employer doesn't cover any of them. So what we can do is, if the person who works at the company has to get the insurance, then we split the family off and we look at say a family of 4, we look at the other 3 members and see what the cost to cover them is versus what that 8.5% is. And if it's more than 8.5% of that income, then they can get a marketplace plan with subsidy. And a lot of people don't know that. That's very key, because that can save a family $300, $400, $500 a month. I talked to a family of 4 recently whose insurance went from $1,200 a month to $1,800 a month.
Oh,
I don't know what I would do if I had to spend almost $2,000 a month.
Whoa, that is crazy.
Yeah. The government has fortunately given us the last 2 years like several options, and so that's another reason to talk with a broker to help make sure you do that math properly, make sure if you do qualify for a subsidy and you can get a better plan, that you can get into that and have the lower deductibles. I think especially people with children, you want to make sure you have the best plan. They're out playing sports and running around on playgrounds and playing on their bikes in the streets and all the things. So you want to make sure that they've got the best coverage that you can get for the lowest price.
Yeah, I mean, you really shouldn't be in a position where you're having to choose between like paying bills in your household and paying insurance premiums so that your kids can be protected. Like that, it's really ridiculous. And we know it can be extremely costly. So again, Cory, tell folks what's the best way for them to find you and get them a quote and help them to navigate this healthcare marketplace.
Well, they always can tag me in the group. That's the first place. Tag me in a group. That's the first place you can do. But you can also call me, text me on business line, 615-818-5345. you can email me at Cory, CORYSR at CoryInsures.com. And the insurance is INSURES.com. So you can email me. You can reach me on LinkedIn, Cory Beal Sr. You can reach me on Facebook, Cory Beal Sr. You can also go on my Facebook page, Cory the Insurance Guy, on my Facebook page. So, it's a wealth of ways you can get in contact with me. Hell, you can reach out to Danielle. She can shoot me a text.
Absolutely. And I just dropped your Calendly link. It's in the comments as well. So if you're looking, again, to get some help with navigating the marketplace, choosing the best plan for you as an entrepreneur, if you're looking for a policy review for life insurance or disability insurance, Cory can help you with that. He can also do a free quote for you for life insurance or any other sort of insurance. So Cory has us covered, even if you aren't in Nashville, right?
Yeah, I'm in 15 states. Okay. So, I can get your friends, your family, and I plan on, my goal is by the end of February is to be in 48 of the 50 states. So be covered. But most importantly, that's why I want people to really think about. I just want people to unbridle their pride and put the ego aside. Listen here, it is people who do take COVID serious, and it's people who don't. Mm-hmm. And it's people that's going to want their children vaccinated, and there's going to be people who don't. That's what you got to protect against.
Yeah.
And you have to ensure that is my money worth, is my family worth that level of protection based on what someone else is going to do, because people are getting sick. You know what I'm saying? And once again, you can best believe COVID will change the face of insurance.
It's best to go ahead and get yourself insured before.
If you're healthy, you never had COVID, take advantage of the subsidies. Take advantage of these plans out here right now that could possibly save you. What you say? You just had a family go from what, 2,200 to 1,800?
They went from 18 to 2,200. We took those 3 dependents off and put them on a marketplace plan. Their marketplace plan with their subsidy cost them $200 a month.
So that's $24,000 a year that families could be saving. So what could you do with $24,000? Well, crypto is a big thing. Right. You could be putting money into crypto. You could be putting money to your retirement.
Put it to
right. You put money in your emergency fund. So look at that we got to have a growth mindset when it comes to this. I'm like, yo, this is real. We have the expert out here that can help us navigate through something that we don't want to do. Because trust me, you guys, I'm going to be honest with you. I've been doing health insurance for a while, but I really didn't like doing it. And I keep forgetting folks call me because they find me on healthcare.gov. And I'm like, well, damn it, you know what? Let me just go ahead and get it done. And then I get to meet Brandy, who has just been a wealth of experience and expertise. And I'm definitely leaning on her knowledge as well, because this is my business partner. So we got some great things coming up, for the community as well. Not just talk about health insurance, but we're going to start diving into the tough talks like long-term care insurance, the importance of disability insurance, things of that nature. The unsexy part of tax-free retirement.
Mm-hmm. Yep. And as an entrepreneur, my last thing is, don't go uninsured and put yourself at risk. You pay so much for so many things that are not really important at the end of the day. Yeah. But you work hard to keep your money, and one major illness, one major accident can literally bankrupt your family.
Literally.
And I mean, I've seen it time and time again. I had a personal friend of mine who ran a construction business and just refused. He did not believe in insurance and lost his whole business, his whole crew of 33 people out of work, had to liquidate in order to be able to get Medicaid. And that just breaks my heart. It does not have to be that way. There are affordable options and professionals who can help you navigate that.
Love it. Thank you all so much for this. This was wonderful, much needed in our community. I also want to just end. I've dropped Cory's Calendly link in the comments, so make sure you use that. He gave you his phone number, ways to reach out to him. This will be available on replay, so go and replay it if you've missed the majority. Also, one last thing is that also you can navigate, you're going to need to navigate the marketplace if you are on Medicare or Medicaid and want to get a plan. a managed care plan on Medicare or Medicaid, so they can help you with that as well. So if you have parents, grandparents that are like, I qualify for Medicare or Medicaid and I don't know the best plan so that I can get all the benefits. There are tons of benefits that you can get with a managed plan.
We do Medicare too.
Yep.
I don't think we say that, but we do Medicare as well.
What I was just saying is that, they can help you with that as well. I worked in Medicare for a long time, and there are just so endless benefits for for seniors when it comes to a managed healthcare plan for Medicare. So hit Cory up for that as well. Thank you so much, Cory and Brandy, for joining me. This has been one of the most important sessions I've ever done. It's very important for us to make sure that we are insured because, again, we just don't know what's going to happen these days. So thank you all so much for joining me. Make sure you all hit up Cory if you have any questions or if you'd like a policy review on your life insurance, if you need a quote on life insurance or on health insurance, Cory's your man. Thanks, everybody, for tuning in. Have a great afternoon.
Thank you, Danielle, for having us.
Bye.